We're back, and our hope is that you'll be back with us as well. Over the last 2.5 months, we've been through a lot and you've been through a lot, and we've all done the hard work to create a safe environment both here and in your communities. We are truly concerned that not that you've neglected your health, but that you've been so afraid to come to the facility over the course of the last several months. That you put things off that really should be paid attention to now. Used to be you could come to the hospital to have your lab work or your x-ray work or physical therapy appointment or radiology or whatever it happened to be, you could just walk in and get that done at the time. Now in order to make sure that we can control the environment and that we can control the numbers of people that are here and therefore keep the environment safe, we're going to ask you to make an appointment. So you can call our central scheduling line to make that appointment. If you come here and don't have an appointment and we can accommodate you, we certainly will do that at the time if it's safe. And if not, we'll give you an appointment for later that day or the very next day. We've done a lot to make this environment safe when we're welcoming you back for outpatient services, same-day surgery, and different diagnostics that you've put off during the course of the last 2.5 months. And some of the things that we did and learned during the course of this pandemic have created a safer environment as we go forward. Some of the negative pressure rooms and the ductwork that you see on the outside of the hospital really isn't just for the pandemic, but will create a safer environment as we go forward, and all patients will benefit from that. 2.5 months ago, we were 120% occupied, and 90% of the patients in the hospital were COVID positive. Today, we have one patient in the hospital that's COVID positive and have learned a lot about masking and temperature taking and the way we can keep our staff and keep you safe. When our employees or staff come in the morning, we do a few things. We take their temperature. We ask them about signs and symptoms that would be related to COVID, the COVID virus. And we're going to do the same thing with you, right? We're going to try to identify people who have a temperature, or have signs and symptoms that would be consistent with the COVID virus. And if that happens, we're going to send them to their providers so that they can get care and make sure that they either have the virus or don't have the virus, but whatever they're found out to have, we make sure that they're taken care of safely. If you're going to have a same-day surgery procedure, again, that's scheduled largely through your physician office with our operating room staff. You'll have a PAT, pre-admission testing process, where you'll receive certain types of tests. One of those tests is going to be a test to determine whether or not you have the COVID virus, so that when you come in, we're assured you don't have the virus and that we can treat you safely and effectively in our surgical environment. We still have a no visitor policy right now. That's something that we're taking a look at and will be guided by guidance that comes out of the governor's office. But if you're coming in for a procedure and you need assistance during that procedure, you can bring someone with you to provide you with that assistance. In the first time I spoke to you, I talked about how the staff was amazing and how the community was amazing. I am still truly awestruck by the work that the staff did during the course of the last 2.5 months and by the support and the work that the community did. I mean, everyone has paid attention to social distancing and has been wearing their masks, and which is why in New Jersey, and particularly in the community that we service, we've seen such a significant decrease in the number of COVID-positive patients over the past couple of months. I couldn't be more appreciative of the work that the staff in the community has done. There's been a real partnership between the two in order to make sure that we have a safe environment then, now, and as we go forward. You've taken every precaution, and so have we. Welcome back.